Hi, my name is Carrie. I am a student nurse at William Carey. Today I will be inserting a Foley catheter on my female patient, Miss Smith. Hi, Miss Smith. My name is Carrie. I'm a student nurse. Today I will be inserting a Foley catheter. Is that okay with you? Okay, good. Let's get started. I'm going to wash my hands. Miss Smith, can you verify your date of birth for me? And are you allergic to anything? Okay, great. I'm going to apply some non-sterile gloves for this part. I'm going to position my patient. Miss Smith, I'm going to get you to lay on your back for me. All right. This is called dorsal recumbent position. And I want you to bend your knees. And I'm going to flex them out to the side like so. Is that comfortable for you? Okay, good. Have a little more room. All right, so I positioned my patient. I'm going to remove my non-sterile gloves and wash my hands again to begin the procedure. All right, so that's done. I'm going to now open my sterile kit. It is inside a plastic bag. I'm going to use this plastic bag as the trash bag in which I will dispose of all of my trash throughout my procedure that I'm not using. I'm going to put this plastic bag over here on my side, away from my sterile field. Alright, so the first step I'm going to do is take apart my kit. I'm going to start by taking this little 1-inch piece here and folding it away from me, but not to touch my patient. And then I'm going to open the sides. And then I'm going to open this last piece. Now I'm going to remove my glove pack and I'm going to place it on a non-sterile field to apply them. Right here. If you guys can see that good. So what I'm doing, I'm going to take my non-dominant hand, place it on the inside of the cuff of the glove to put it on my dominant hand without touching the sterile part. See that? It's not touching me and it's not touching anything. I'm not touching anything that's not sterile. So now that I have the sterile glove on, I can now use it to maneuver for the one that's going on the non-dominant hand. I can touch the inside like so to put it on. There we go. And that'll be a piece that we clean up later because it's now considered not sterile. All right, so I have removed everything. I put my gloves on. So my first step after removing my gloves, I'm going to remove, I have 2 drapes. I'm going to remove these 2 drapes out of the tray. The first drape is going to go under my patient. There's a smooth side and a rough side. The rough side is the absorbent side, so that side is going to go up. So the absorbent side is basically touching my patient's leg, or upper, yeah, their legs. All right, Miss Smith, I'm gonna get you to just kind of hold your butt up a little bit for me while I slide this under. There we go. So now my drape is under my patient. I think we can see it. So my next step is to remove my second drape. This drape has the hole, so this drape is going to go over the vaginal area, like so. All right. Okay, so now that that is done, now what we do is we have our sterile fill on our patient and everything. So now it is time for me to remove my items that's needed from the sterile tray. So everything inside of this tray is sterile. So I can now touch it with my sterile gloves that I have on. Okay, so I will start by removing my Foley, which is here. And I'm going to take this and I'm going to actually fold it in my hand so that it does not touch anything that's not sterile. Like so. Okay, and so now what I'll do is I will get my 10cc syringe, which is here. This is sterile. So I am able to remove the cap. And I'm going to throw the cap in the bag. And now what I'm going to do is hook this syringe to the catheter. Like so. Okay. And then what happens is I am going to twist it until it's secure. And it's secure. Once it's secure, I can now lay my Foley in the attached syringe onto the sterile field. Like so. Can you see that? Kind of working with limited space in here. Okay, so now what I do is I have my sterile cotton swabs here. So these are the cotton swabs that we're going to use to clean the area. And then we also have lubricating jelly. So these here are already dipped in iodine. So sometimes you may have regular cotton balls where you have to pour your iodine onto those balls, but then you may have the cotton swabs like I have here, and you don't have to worry about doing that extra step. So what I'm going to do, I'm going to open my cotton swabs. I'm going to throw this top part away. So I have 3 in here. The first one I'm going to use is to clean one on each labia. So I'm going to take my non-dominant hand, which is now about to become unsterile because I'm about to touch my patient's labia. So I'm going to open the labias. I'm going to take one swab. And what I'm going to do is we want to clean the female patient from top to bottom. So what I'm going to do is I am going to clean the meatus. I'm going to do the left side first, from top to bottom. One swipe, throw this away. I'm going to do the right side, top to bottom. Throw this away. And then I'm going to do right down the middle. Top to bottom. Throw this away. So I'm now done. I can throw away my pack that had my swabs in it. And so now we're ready to actually begin the process of inserting the catheter into the patient. I'm going to take my lubricating jelly. We're going to put it on the tip of the catheter. I apologize, I forgot to remove I don't want to get it on me, so I'm going to kind of step back so that I will not touch my clothes. My clothes is non-sterile. Here we go. Put that in the bag. So now I'm going to take my lubricating jelly. I'm going to put it on the tip of the catheter. And again, this is a female. So with the female, I only have to do 1 to 2 inches. Okay? So Ms. Smith, I'm going to now insert the catheter for you. Are you okay right now? Okay, good. All right. So now what I'm going to do is I have lubricated my tip. I'm going to insert 2 to 3 inches into the meatus. Okay. You okay, Ms. Smith? Okay, you can take some deep breaths if you need to. Okay. I'm not using force while I'm inserting this into the meatus. I'm looking. All right, so now I'm going to insert it a little bit more. All right, so now I have some urine return. So now that I have urine return, I am going to, I said that backwards. I'm looking for urine return. Now that I have urine return, I will now insert it a little bit more, about 1 to 2 inches. All right. So the catheter is secured with my contaminated hand here. It's kind of a bad angle. It's secured with my contaminated hand. What I'm going to do is inflate the balloon with my non-contaminated hand. All right. I apologize if this is a bad angle. I just realized that. So now that I've done that, I've inflated my balloon. I will check to see if I feel resistance with my sterile hand. And I do. Okay, and now that that's done, I will now secure this catheter. This is a female, so I'm going to secure it to the upper thigh with the tape. Okay, and Ms. Smith, you're doing okay? Okay, good. All right, so I'm going to leave a little bit of slack in the catheter so that she's able to move her legs freely. All right, and there's no kinks in the tubing. Everything looks good. So I'm going to hang the bag from the bed frame, but I'm not going to let the bag touch the floor. All right, how are you feeling, Ms. Smith? Okay, good. So now that my catheter is inserted, it is secured to the patient's leg. The bag is hanging freely from the bed frame and it's not touching the floor. I will now pick up my extra trash. And remove my gloves. And wash my hands. And then I'll now document the procedure. I will document the time that it was done, the size of the catheter that was used. I will also document anything regarding the urine, the amount of urine, the description of it, the color, if it had an odor, anything like that. And my patient is now good to go. Oh, and I will also document the patient tolerated the procedure.